Good evening, everyone. I think we're going to get started. It's 6 o'clock on the dot, and I think people will just continue to filter in. But welcome back to the Canadian Concussion Centre's webinar series, which is sponsored by LIUNA, the Laborers International Union of North America. I'm Lesley Ruttan and really pleased to be moderating our ongoing series that was developed for individuals that have experienced concussion, their family, as well as healthcare providers. And our sessions focus on various aspects of concussion. We typically have an expert speaker who speaks for the first half, and then we open it up to questions from our audience. Tonight is going to be a special version in that we have 3 individuals who have actually lived through concussion are going to be with us for some discussion. The sessions recur every other Tuesday evening at 6 o'clock. For those of you that haven't attended before. So before I go any further, I'd just like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. Even as we meet virtually, it's important to recognize the lands we each call home and reaffirm our commitment to improving relationships and understanding with local Indigenous peoples. From coast to coast, we honor the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. So back to the concussion series, just so that you know, all of our previous recordings are archived, and you can find those on the Canadian Concussion Centre's website. And just for this evening, if you have any questions, if you sort of move your cursor to the bottom of the screen, you'll see that there's a Q&A. We just ask that you enter any questions there. If you're having any difficulties, technical difficulties, please enter those into the chat, and Michael can help you there. He has also very kindly just inserted the link. If you want to click on that, that will actually take you to our previous recorded webinars. So we're also, as we always do, we're just going to run a short poll. We always like to get a sense of who is in our audience. It just helps for our planning. So we'll just give you a second there. Okay. All right. So as I said, I'm really pleased tonight. We've got 3 individuals that have joined us we're going to basically have a discussion tonight. I'm going to be asking them some questions around their experiences. And so we're going to be hearing from each of them. And then after that, we'll open it up to you. So if you have any questions for our guests, please enter those into the Q&A. So with that, I'm just wondering if people can maybe turn on their cameras, or that may happen automatically. What I'm hoping to do initially, there we go. There's Antonetta and Santino and Christina. Thank you all for taking the time to join us tonight. It's so great we were just sort of chatting about this before we came on. I think it's really helpful for people to hear from others that have lived through concussion, to hear about their experiences, to hear, what worked, what didn't work. But the first thing that I was going to sort of have each of you do is just, if you can introduce yourself and maybe just provide a little bit of background in terms of how your concussion occurred, how many concussions you've had, and also just what you're, currently doing, whether you're working or in school or. So maybe on my screen, Antonetta, you're the first one on my screen. Can we ask you to go first?
Okay, yeah, sounds good. So, hi to everyone, and my name is Antonietta. My concussion and whiplash occurred in February 2024 as a result of an accident. This was my first and, God willing, only concussion whiplash experience. Thankfully, I'm much better now, and currently I'm a full-time student pursuing my degree in primary education. I would like to be a teacher, and I also work part-time. And that's it.
Great. Thank you so much. Santino, can we move on to you next?
Yeah. Hi, my name's Santino. I'm in my fourth year at York University. I'm studying law and society, trying to be a police officer. I've had 6 concussions in the last 4 or 5 years, and they all have been related to football. And yeah, I'm still in school currently.
Okay. And can you maybe talk just a little bit? I should probably ask Antonetta, just in terms of, so you've had multiple concussions. Are you still experiencing symptoms at this time?
Um, Not every day. I definitely have some days where I feel foggy, or I don't feel 100%, or like I just don't feel like all there entirely. But most days I feel pretty good. I feel like my brain has definitely healed a considerable amount from my most recent concussion. So
Sorry, when
yeah,
did
I
you
think
say when
my
was the
most
most recent?
previous sorry, my most recent concussion was in October of last year,
Okay,
2024.
okay. And are you still playing football?
I'm not, no.
You are. Okay,
Yeah.
okay. And Antonetta, can I go back to you just for a second? I'm just curious about like your symptoms now. Are you still
Okay, well,
symptomatic?
I basically for me, what I'm noticing is that if I'm in like a very loud or busy place, for example, like at Scotiabank Arena, that's my part-time job, but
Mm,
I can't be directly in the concert. Like I can't, I'm usually in the box seat, so like I'm further away. There's a distance. I have earplugs. Um, I'm in a calmer area. It's not very bright. Like, so basically, I can't be in really bright, loud, noisy environments. Because I'm in a room, like in the box seats, the suites, it's smaller and I'm like away from the action, I'm able to do it.
mhm.
But like there was an orchestra at the arena and I wanted to check it out and to see if I can like withstand it. And because there was pyrotechnics, lights, like all types of things, I couldn't stay. Like I had to cover my eyes. I was getting pressure. It was too loud. Earplugs were in. Like I couldn't, I still can't go to a concert. Um, I also can't be in loud, noisy environments. Sometimes I notice like fogginess, like as Santino was saying, like I just don't feel 100%, or like my reaction time might be a little slower. Like I need a lot more repetition, or my learning could be takes a little longer than let's say before. Like I can pick something up sooner, but now it's like I just need a little extra to do the same thing.
Mhm.
Um, Other than that, the noise and the like head pressure headaches, that still happens. And if there's like a lot of people walking by me, I feel like I could be dizzy. Like I need to not
Mhm.
look at a lot of crowds and a lot of people moving. It makes my head hurt.
Yeah, 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 yeah. Not unusual at all. Okay, thank you.
You're welcome.
Christina, can we move on to you?
Hello. So I'm Christina. Um, I used to be an athlete, like a full-time athlete. I'm in my second year. I'm studying psychology right now. Um, so I've had 4 concussions within 5 years, and yeah.
How can you tell us how you sustained your concussions?
So I got my first one when I was very young, and then throughout high school, I got 3 more. And then my most recent one was like it took longer to like recover. So from there they
Okay.
like prohibited me from playing anything.
And what were you playing?
Volleyball.
Volleyball. Okay.
Yeah.
So were the three in high school all from volleyball?
Yeah.
They were. Okay.
Hmm.
Okay. And when was your most recent one?
Last year in June.
Last. Okay. Okay. And are you still, you're in school now?
Yes, I'm in school.
Yeah. Okay. Okay. So you're all in school. That's great. And has it been like, has school been more challenging, do you think?
Recovering from the concussion, yes, it was challenging, but
Yeah.
now that I took the year off of not getting hit in the head, I feel better.
Mm. Okay. Okay.
Yeah.
Okay. Great. Okay. Well, thank you so much. Um, we were hoping to hear as well, just because it sounds like all of you, like it's great to hear that you're all back in school, and it sounds like, yes, some of you are still having some symptoms, but you're still, managing to function, to do some part-time work, to be in school. Just curious what you feel has like helped with your progress, like over time, and we'll go back to you, Antonetta. Um, just curious, what your experience has been like over the course. I guess it's been about a year
Mhm.
uh, since your accident.
So some factors that helped me and my recovery on a spiritual level were prayer from my church community, having support from family and friends, like their love, and just on that's from that end. But on a medical end, I would just follow the doctors uh what they've told me to do. So basically stay away from screens, um, reading. I rested. I went to physiotherapy, different types of therapy I was engaged in. Now my therapy is done. Um, I would take vitamins, and then basically like just challenge myself to overcome those things little by little to increase like screen time. That way I could be productive in school, right? And attend classes and stuff like that. So those are some things that help me.
That's great. And so did you take, like, was there a period of time that you took off after the accident from school?
Yeah, there was about, I would say, reading week. Then there was, I would say like 4 weeks.
Okay.
Yeah, about 4 weeks. I think, yeah, 4 weeks.
Yeah. And then did you just sort of jump right back in, or did you go back gradually?
So part of what like my doctor would tell me to do is like it's small increments. So you go half day for a few days or a week, then let's try a full day, and then that's it. Just increase step by step and just check in with myself, do as much as I can. And I really want to get better. I did everything they told me to do, and I always push myself to do more because that's the only way to get better. And I know how I feel. They would say, like, you know how you feel. So you know your limitation. And because I kept trying and I wanted to like get better and better, if I had to slow down, I would just tell them I need to slow down. But then the next week I would try to increase my school time, my screen time, or my reading time to, and like even driving, it was difficult because I had the car accident, increase my
Yeah.
distance driving and my comfortability, like not being scared to do that. So it's really
Yeah.
important to challenge yourself and not stay stagnant. Like don't feel like, no, I can't, or I'm scared to do it. No, you need to push yourself and try. Listen to your body, but still keep pushing forward. That
Right.
was something like determination, like very important. You need to keep going. Um, that was very important. And that was the time that I need. So slow increments, the doctor said do that. And then I was able to fully do like school and work and all of that. Work was a few
That's
months
great.
after that.
Okay.
So
So you
I wanted,
started with school. That was sort of
yeah,
the priority.
the
Yeah.
priority was school, manage school,
Yeah.
be able to do that well, and then let's do work. And then work, they would put me like in spots that were very quiet, not very bright, not very loud, because you're not in the action with my job that I do. I'm
Mhm.
away, like I'm displaced from it. So they gave me spots that I can handle, and they would move me if I needed to be moved. They were very accommodating.
Oh, that's great to hear. So it sounds like the gradual uh, sort of return really worked well for you.
Yes. And
Yeah.
always improving,
And
always getting there. Like
yeah, yeah. And I'm curious, so the 4 weeks where you were off school, what did that look like for you? Like what were you doing during those 4 weeks?
I was resting. I started therapy as soon as they would take me, like within a week. I started therapy. Whatever they told me to do, the doctors told me, that's what I did. Went to my doctor's appointments. I rested. I was so tired. It was very hard to stay awake for a day, and how little things would stimulate me. And it was like this much I can handle. And then I needed to rest. And then it increased and increased and increased. And now it's like I can do everything normally. There's no barrier other than like very loud noises and very bright places.
Yeah, yeah. Okay, that's really great to hear. Um, okay, maybe we'll move on to Santino. Santino, so your concussion history is a little bit different, where you've had concussions kind of on and off. Were they all through your teen years and the
They were all through a majority of my university career with
okay,
football at York.
yeah,
Yeah.
yeah.
So I remember my first one, it was a pretty significant one. Um, Completely blacked out, didn't remember what happened. I just remember waking up, open my eyes, just felt like someone was just flashing a light in my eyes the entire time. Couldn't really see. I saw the only time I was able to see if the athletic trainer was right in my face.
Mm,
Took me to the hospital. That one, the first one lasted about a month to recover, I believe. Um, there was, and then the next couple were minor concussions, and then my most recent one was a pretty major one.
okay,
Um, yeah, so I was very fortunate to have the athletic care here at York University with
right.
Dr. Shukla, and their return to play process is very well done. Just having giving me all the time that I need, helping me with my school. Like I would just they would email my professors for me, say, hey, this student of yours has a concussion, he won't be able to come to class, and they would give me as much time as I needed.
Hmm.
Um, and the return to play process, just test out. It was gradual, like Antonetta was saying, like just gradual steps, just until if I keep feeling better, I'll move on to the next step.
Yeah,
I went to a couple of vestibular labs to work on my neck as well because I've had weak neck muscles. Helped with my balance quite a bit since the first time I saw Dr. Tatter till now has improved. Um, yeah, so just pretty much as Antonetta was saying, like oh my God, the gradual help it's great. Like it's what's worked for
yeah,
me as well.
yeah. Okay, that's excellent. And I'm curious, with being in school, did you require any accommodations? Like, did they help you with things like that? Or was it more
Yeah,
just a gradual?
they helped me. Like it was gradual returning to class, and like if I needed an extension, they say, yeah, like no problem. Take as long as you need. We're not gonna dock you any marks or anything. So everyone
Okay,
was pretty good. Yeah,
okay. Oh, that's really great to hear. Really good to hear. Okay, thanks, Santino.
of course.
Christina, can you give us a bit of, yeah, what things have helped you recover?
Well, I would say one of them would be rest. So, yes, listen to your doctors when they're telling you no screens, just do absolutely nothing, dark room. That helped me the most. And I also did the return to play with Dr. Shekla as well. And I can agree, like his steps to proceeding like with your concussion, the protocols, amazing. He was very like easygoing because my post-concussion symptoms were worse than the actual concussion because they lasted for so long. So I would say he helped me with like my balance. He did a bunch of cognitive tests to help me with my memory because that was my big problem since I was in school. So I couldn't do tests properly or the way I used to do them. And yeah, I would say support as well. because I had major like anxiety and depression from that. So your family and friends play a big part in that.
Yeah. Yeah, that's certainly been, yeah, what I observe as well. So that's really great to hear. Um, on the flip side, wondering, and we'll just go back to Antonetta, you know, looking back over the last year, do you think there's anything that sort of slowed your progress or that was
Um,
problematic?
okay. Just to reiterate what Christina said, Dr. Lesley, it's very important. I didn't realize it, but actually a friend of mine went through a concussion and she told me like stay away from screens. Like it's really important. No screen time, dark room, don't even read. Like it's very stimulating on your brain and it needs time to heal. So I think if I didn't do that, because she told me that's what she learned a lot as well, because she didn't really do that because she didn't really know or take it seriously. And it affects her so many years later. So important to stay off screen. Um, and be in like a dark room, don't read, like rest, because your body, your brain really needs it. So
Yeah, I think I would just add because I hear what you're saying, but just so that everyone is clear out there, the old advice used to be, yeah, they would tell people to go into a dark room for an extended period of time, and that is no longer um, considered to be best practice. We definitely want people in that acute period, probably 24 to 48 hours. You're absolutely right. Like you want to be kind of low stimulation. But I just wanted to make sure that because we sometimes do, we know that if people go into a dark room and stay there for a week or 2 weeks,
oh
it
no,
actually can
yeah,
come back.
it's
So
bad.
I just wanted to clarify that. Yeah,
Yes,
yeah. But I hear what you're saying. Yeah, as far as the screens and yeah.
100%. Yeah, no, that would not be good. And that was, yeah, just in the beginning. And I just find that that helps me. Like, I'm not a doctor, I'm not giving any medical advice, but that just helped me. Like, even when I have pressure in my head, I just rest and it's
Yeah.
like I close my eyes, I put a cold pack on my head because like Tylenol wouldn't help with pressure in my head. So, like, I had to
Mhm.
find different ways. And just a short time of that would help me, but not like extended periods, days, like it wasn't.
Yeah. Just taking shorter breaks and
Yes.
yeah, yeah. So
Factors you back to your question.
yeah, yeah,
Something that hindered would hinder me with just being in loud, bright, busy environments would slow my progress because it was just too stimulating.
yeah,
Overstimulation just it would cause pain, like pressure in my head, and then I would just need like 6 hours to feel better from that one
right.
situation.
Yeah.
So that would not work for me. But now I'm okay.
hmm hmm And you're aware of what your triggers are, so as to sort
Yeah,
of avoid. Yeah.
that's right.
Okay.
I stay away from my triggers for now, but I still try to expose
Yeah,
myself. But then
which is great. Yeah.
I step back because I don't want to get to the point where I need to not like recover for 6 hours. Like, no, I'll just
Yeah.
little exposure and come back.
Yeah, yeah. And sometimes there is that sort of trial and error because everybody's different and just
Mhm.
sort of learning what your body can take. But I love that, the fact that yes, you're not sort of closing yourself off to everything. You're still exposing yourself in little bits, which I think is really healthy. So that's great. Okay, Santino, anything that you're aware of that was sort of problematic or that hindered uh, your recovery?
Um, to be honest with me, I was very anxious. Um, and my anxiety and stress, I feel like that played a role in it because I was always thinking the worst. I'm like, CTE is gonna happen, brain bleeds, all that stuff. Like I'm well aware of the risk football gives you with
Yeah,
concussions and what comes along with concussions. You see all these stories about these NFL athletes unfortunately killing themselves over the CTE and stuff like that, and there's nothing that you can really do about it. But yeah, it's honestly, for me, it was mainly just the stress and anxiety of all that stuff, thinking of what if
Mm,
this happens to me. And I
right.
would feel like I would kind of just like hide myself in a dark room and just lock myself away from the outside world and not try to
Mm,
benefit myself to get better. And it was
yeah.
really a struggle. It was a low point for sure. Yeah, I feel like that was the most hindering part of my recovery. Also, like even like screens, like even trying to read and stuff, like I couldn't even go on that for an hour without getting a headache and just wanting to go to sleep.
Yeah.
And
Yeah.
loud noises, big crowds, just weren't there was just too much.
Yeah. Yeah. Absolutely. Well, thanks so much for sharing that, because I think that's not uncommon. When we have anxiety, yeah, or depression, we tend to withdraw. We withdraw, and then there's fallout from that, and it often makes things worse in the end. So thanks for sharing that, Santino. How about you, Christina?
So with my second concussion, actually, I was, as Santino said, like I was anxious and I was very depressed, and I took my time with all my protocols. And then when I had my third concussion, I didn't want to not do anything. So I would say like excessive activity is what triggered me, because I continued right after my concussion. So I was like, I need to get back into it. I don't want to get into my depressive episodes or get anxiety like the way I used to. So I'd say after that, it was excessive activity because I didn't stop.
Mhm. Where you just sort of pushed yourself too hard
Yes.
and then you set yourself back. Yeah. Okay. Okay. Um, the next question is just around family and friends. And I know that a few of you have already brought this up, but does anyone want to comment any further on the role of family and or friends in your recovery? Antonetta?
Yeah. So for sure, the role, like family and friends, were, I think, that and my faith in God like really got me through this, without a doubt. So like their prayers, um they would check in, they wouldn't add extra things to my plate. They would just want to like take me to appointments or like help with like everyday or practical tasks like cooking, and just like focus on taking care of myself. Like, you don't worry about us. What we have, like, how can we help you? And so just their support and prayer and my faith is what I believe allowed me to like continue in school, work, and like heal and move forward.
Hmm. That's great. I'm glad that you had that.
It's a blessing.
Uh,
It truly is.
yeah, yeah. Santino, did you want to comment at all on that one?
Yeah, for me, like as Antonio was saying, my family was a major role. They I would have a couple of my aunts with me with my alongside with my mom. They would take me to my appointments. They would sit with me in my appointments, or even the odd time I'm away at school. I'm originally from Hamilton, so I live at a student house. So I'm by myself with a couple of roommates, but my dad would drive up and take me out for lunch just to make sure that I'm okay. My
Yeah.
roommates were a great help. They would come check in every so often, see if I wanted to come upstairs in the living room, uh, just hang out with them. But I couldn't because it was just too much late, too much noise. But
Yeah.
yeah, friends, family, they played a very big role for me, and that was what kind of also helped me out of like my anxiety and stress. That like, okay, I have all these people who love and care for me, that I'm gonna go out, I'm gonna go to my appointments, I'm gonna go get better so I can join them again and not have any, or try
Mhm.
not to have any issues.
Yeah. Oh, that's so great to hear. Thanks, Santino. And Christina?
Basically the same thing. Like I had my mom and dad and sister that were constantly with me. Um, Especially my dad, like with my memory, he knew I had trouble with it. So like he bought a bunch of games, like board games, like memory board
Mhm.
games. So we'd like play together. So yeah, they
Oh,
definitely helped.
that's great. Yeah. Yeah. Yeah, it's so important. There's definitely a difference, I think, for people who have that support versus those that don't. So I'm really glad to hear that you all had that. Next question is, do you have any advice for healthcare professionals when they're, dealing with individuals that have had concussion? Antonetta, go ahead.
Um, I think the healthcare professionals that I interacted with were wonderful and very helpful and like great at what they do. Um, I I just think generally like it's important to like truly listen to the patient, ask them thoughtful questions, like just about their life, like their lifestyle factors that impact their life, and like a holistic view of them. Sometimes it feels like you go here for this and then here for that, and it's like almost like the system is fragmented. It's not really helpful. Like unless you have support, someone bringing you to an appointment, you can't drive, and then you have to rely on all these other factors. And I think like a more cohesion and less fragmented system of like accessing things like would be helpful for the patient, and just like truly listening to them. Sometimes I found like if it was a specific doctor for this thing, it's like 10 minutes I have, like, let's go. Like that's another doctor's thing. I just do this. So like kind of really truly listening, asking thoughtful questions, and like how can I support you with the challenges you have?
Hmm.
I think would
Yeah.
be a nice way to approach.
Yeah, and I think we hear that a lot just in terms of that fragmented care. And absolutely, because when you're dealing with the brain, which of course controls absolutely everything, it's no surprise that you may need different types of healthcare professionals to help you in your treatment. But you're right, there are often one's here, one's there, and they don't always talk to one another. So
Yeah, that
it's like
connection.
you
You're
need
really,
a you need a case manager, right?
yeah, that's sometimes I'm like, oh, they have to send it to that. Like you need so much time just to like make sure. Yeah, exactly. Like there is a lot of pieces moving and they don't always connect with each other. So,
Exactly. And when you're dealing with, things like memory issues or,
yes.
it's hard to be that person for yourself necessarily. So I hear you. Santino, do you have any advice for healthcare professionals?
Honestly, honestly, I couldn't have said it better. With working with Dr. Tatter and Dr. Shukla, they've been phenomenal. They've listened to everything I've said. They've ran thorough tests when they really didn't need to. There wasn't proof, but they still did it. Dr. Shukla, I've seen him so many times when I didn't even need to see him. I would just go make an appointment just to go and talk to him because he was that kind of doctor. Like he looked
Mhm.
at me as a patient and not just a football player. He had true care and didn't say, okay, we're gonna do like what we can, get you out as soon as possible to get you back on the field. He always cared about the patient more than the football player.
Mhm.
So basically, if I have any advice, it'd just be just to listen and just care for them as much as you can, because I don't know how it is for everyone with concussions, but for me it was more of an emotional time.
Yeah.
Definitely felt at my lowest points with concussion. So just knowing that I have healthcare professionals backing up my corner made me feel 10 times better.
Yeah, that's great. Thanks, Santino. Christina.
Exactly what Santino said about Shukla. I would also book appointments just to talk to him. It was like a therapy session because I was also going through not being able to play volleyball anymore, and that's all I've ever been was an athlete. So it was very hard for me, but he definitely helped me with transitioning to remembering who I am as a person and discovering that. So I feel like
Yeah.
listening is a big factor, but they did a great job with that.
Well, that's really good to hear. I'm glad. Um, Okay, well, I think what time are we? Okay, that works. I'm just looking at the time. So I'm just going to take a look at some of the questions. So this is more a comment, but Jim's saying, I have a problem with interruptions. I think he's saying he can get really agitated. So I've certainly heard this before, but did any of you experience anything like that? Sort of irritation, agitation, perhaps if you were working on something and someone interrupted you.
Yeah, that happened with me a couple times.
That-
Yeah, if someone were to interrupt me when I'm talking, I would just be it would just wouldn't sit with me properly, or my temper would be a little shorter. Just not even if someone interrupted me, if like I'm just having a conversation and I didn't like something that they said, I would feel a little bit more angrier than I would, I guess anyone would normally be or
Yeah,
feel. Yeah, that was definitely something I've experienced.
yeah, yeah. And it's, yeah, not unusual. It's something that we definitely heard. Often people just have kind of a shorter fuse, and uh, and that can absolutely occur. The next one, it seems like Antonetta's doctor knew how to advise her, which is unusual. Did she see a specialist or was this her family doctor?
Sorry, what was the question again?
I think the person is wondering about who was advising you. Like, was it your family doctor that you were dealing with, or did you have a specialist that you were dealing with?
Oh, okay, so I spoke with the concussion clinic out of Mississauga. The doctor referred me to them as well as my family doctor, the physiotherapist, and he did concussion therapy as well. Um, then I saw a neurologist. I saw Dr. Tater. Um, there was a few doctors that I was sent to based on like a referral from a doctor would say, okay, I think you need to see someone about this because I would
Mhm.
explain to them what I was going through. Um, and yeah, I think it's important too to advocate for yourself because, or at least have someone help you. Like my dad would also come with me sometimes to appointments, and like I would forget some things and he would say it. And then my doctor would say, oh, okay, then you need to see this person. So, I
Mhm.
mean, your family doctor, the physiotherapist, the concussion clinic, the doctor because I went to the hospital the following day after my accident, they gave me some
Yeah,
recommendations. Um, and then keep asking, like keep saying like this is what's going on. How can I better this? Or what can I do? This is what's happening. Um, because they don't know what you're experiencing, so you have to really explain it, or they'll like a good doctor will ask you too, like questions to help.
yeah, yeah. And usually the treatment is very symptom based. So, there's a
Yeah.
lot of different symptoms that people can have after concussion. So, and they're not always the same. So someone, one individual may have, very severe headaches, versus someone else who maybe doesn't have headaches but has a lot of, you know, dizziness and balance issues. So, um, yeah, this is where you end up sort of going in different directions to seek out those specialists that can help with those symptoms. Um, Allison is saying it's very difficult to, I think she's saying, access mental health therapy. Who, where can you access help? What if you're financially unable to pay for private counseling? Um, I can certainly speak to some of that, but in terms of, and again, only, comment if you feel comfortable in terms of, was this something that you ran into during the course of your recovery? In terms of, I know we heard a bit about anxiety and and depression. Anybody? Oh,
Well,
Antoinette.
I can offer that like I've experienced in my life like depression and anxiety. Thankfully, like thank God I'm well from that. And I thank God for that. Uh, as well as therapy. Like I think things work together.
Mhm.
So I did therapy, and what can help this person, what I found out is sliding scale. So based on your income or what you like, if you have benefits or you don't, there's a sliding scale where you can, based on your income, you get therapy. So, because last time I checked, it was like $300 for 1 hour. I don't know if things changed, 350. Like this was pre-COVID, right? So that was a while ago. But now everything's
Yeah.
inflated. So maybe it's more the same, but sliding scale will help. There's also like with the Catholic church, they offer counseling services like non-for-profit organizations. That's like a tip that I learned through accessing counseling that might help. I'm trying to think of what else. I'm not sure, other than, sliding scale. And like religious organizations maybe offer something covered.
Yeah, yeah, it's true. Santino or Christina, did you have any comment on that piece of things?
Um, for me, I was as a student, there's so much that the school has to offer for being able
Yeah.
to access mental health therapy. I see it as like specific therapists for like athletes. I've also seen therapists that just help with your common student with anxieties and stresses and like that. I feel like for me, what worked best was um the sports therapist, because they've been in my place before, and they're able
Mhm.
to really kind of dissect what I was feeling and kind of help me with different methods like that. Like I said, it's very at at school, it's very easy to get help here. Literally walk into anywhere and there's posters everywhere that tell you how to get it.
Yeah, yeah, yeah. It definitely, if you're a student, it makes things a lot easier. Christina, did you want to comment on that at all?
Sure. So I did therapy that was provided from Humber, so from my school. And I also did it outside, but I didn't necessarily enjoy it and it wasn't helping me. So I took things into like my own hands and like my dad actually helped me. So I don't prefer therapy, but that's just me. But they
Yeah.
provided it. Like my school did, and
Okay.
it's pretty easy to get therapy as well. There is
Yeah.
posters.
Yeah. Yeah. So as a student, there's a lot more available. But if you're not a student, then the question becomes, okay, where am I going to get therapy? And you're absolutely right. So in Ontario, to see a psychologist privately, unfortunately, we're not covered by OHIP. So people have to, use their insurance or and pay out of pocket. There are certain psychologists, just as Antoinette was saying, you can ask about a sliding scale. There are free resources out there. They're at Toronto Rehab. This is not individual therapy, but we actually there's something called the Tele Rehab Center for ABI, or acquired brain injury, that offers free group therapy for individuals with any kind of acquired brain injury, including concussion. So there are things like mindfulness groups, cognitive behavioral therapy groups, and so on. You can also access, there are also groups through brain injury organizations, like, for example, in Toronto, the Brain Injury Society of Toronto. There's peer counseling through the Ontario, through OBIA. So there are things out there. Um, uh, but yes, it can take a little bit of digging to get there. Okay, I'm going back to our list because I think we've got a lot of questions. So are you fearful for future concussions? Do you have anxiety thinking about what might happen if and when you have another one? I'm seeing head shaking. Santino, go ahead.
I mean, yeah, I think about it every day, getting in and out of my car if I hit my head, because I'm very prone to having concussions. So
Yeah,
yeah, it's definitely very scary. I gotta watch, be more alert, more diligent of what I'm doing and my whereabouts. Yeah, so it's very stressful, very fearful at the same time.
yeah, yeah. Christina, how about you?
I'm very anxious about it. And I also coach volleyball now. So every single day
Okay,
I go to practice, I'm worried.
there's balls flying everywhere.
Yep, I don't like it.
Yeah, yeah, Okay. Antonetta, how about you?
Um, no, I'm not nervous at all, or scared, or worried.
Okay.
I usually play outdoor volleyball on a women's league in the summertime, and I didn't do it last summer only because of my concussion. And talking to the doctor, he's like, maybe I would, your balance is not good yet. My balance wasn't very good at that time. Um, And if you fall or get hit in the head by a volleyball or a ball going really hard, like this is not good. So you do not want a concussion again because then you're going to start over. So I was like, okay, I'm not going to do it this year, but I think next year, like this summer, I would love to do volleyball. But at the school, I want to volunteer, but I'm also scared that I might get hit, but I'm gonna go for it and like play volleyball this summer. I plan to, for enjoyment, and then,
Mhm.
yeah, so I think it's important to challenge my fears. Not to, like, it's dangerous to play volleyball. I can go outside of my house and get hit by, anything can happen. So I have to live my life.
Mhm.
And if I
Yeah.
can't handle being in that sport because it's happened to me and I don't want to endure it again, then I'll pick another sport like badminton where a birdie is not going to give me a concussion. So,
Mhm.
but yeah, I mean, it's a thought, but we have irrational thoughts, right? As a human, like not all thoughts are good. So outweigh
Yeah.
the positive with the negative and challenge fear, not to live in fear
Yeah.
is what
And I
I,
think depending on where you're at, yeah, where you're at in your recovery as well, I think, especially for athletes, who have had multiple concussions and when you're still symptomatic, yeah, I think, it then becomes, okay, how do I manage my anxiety? And that's where, there absolutely is help. For those that have had multiple concussions, so Christina and Santino, has the concussion manifested differently each time? Like, have you had different types of symptoms? Uh, Christina, do you want to go first?
I wouldn't say it was different symptoms. I would just say the duration of how long it took me to recover was different. Like they were both
Okay.
major concussions, but sometimes it
Yeah.
would take a month or sometimes it took months. So I don't know why that is, but my symptoms were the same though.
Okay. Symptoms are the same. And is it the most recent one that took the longest?
Yes.
Okay. Okay. And Santino, what about for you?
Um, my major concussions, the recovery time took close to a month each major one. The minor ones, they maybe about a week and a half. For symptoms wise, with my minor concussions, I would experience slight sensitivity to light, a little bit of headache, like nothing like out of the ordinary. For minor concussions, but with my major ones, it was could barely open my eyes for longer than 20 minutes. Head was like it was just a constant pressure in my head, headache. Just felt like I was wearing a bandana the whole time. Um, yeah, the major concussions were definitely different and a lot worse, and I couldn't be in a room with people at all because my head it would just be too irritating for my ears. And I would be
Yeah.
sleeping for hours on end.
Okay. Okay. Great. Thank you. Um, Liz is asking, there seems to be a good method or formula for return to play. What is the method for return to work? Is it as defined? My daughter and I have both had a concussion 2 years ago from a motor vehicle accident, and the return to learning and my return to work has been very challenging. Um, I know we have a lot of questions, so I will say, Liz, just so you know, um, we have individual videos. Leslie Burkett was with us not too long ago. She's an occupational therapist and did a great return to work. So we've got a whole recording on that. And I believe we have for our next one, it's actually return to learning. Nick Reed is going to be with us talking about return to learning. So um, just back to our panelists, did you want to comment, anyone, in terms of return to work? I guess that would be you, Antonetta.
Yeah, just that I believe it's the law that they modify your duties. That they work with you to have a safe transition back to work. And it should be based on, like, you have doctor's notes, right? So it's your lead, how much or how little you can do, and how they can modify your task or your job responsibilities to meet you where you are and build on that. Because the idea is full integration, 100%, right? We want to be back to our regular life. It's on your time and how you can get there.
Mhm.
I mean,
Yeah, and
yeah.
oh, go ahead.
I was just like thinking that if I had a desk job where I had to be in front of a computer 8 hours a day, I don't know if I can really do that 100%. Like, even for teaching, like when I first started going back, I had such memory issues that I was like, I don't know. Like, I hope my brain catches up here. Like, I hope everything's okay, because teaching is a highly cognitive task when you're actually teaching with students and all the responsibilities involved. So, thankfully, it all worked out. It just took time and patience and grace for yourself and the people around you that you're going to get there, and to build like that back into your routine, right? Like small tasks and then increasing the demand, basically.
Yeah, absolutely. So, yeah, so Liz, I would suggest checking out our other webinars on the return to work and return to learn. There also is a pilot program running through the Ontario Brain Injury Association, OBIA, that is a return to work. I'm not sure how long it's going, but it's right now it's a fully funded program where they will work with both an individual that's trying to return to work and the employer to help facilitate that process. So if anybody is in that, in the midst or just about to begin that process, you may want to look that up. Again, that's OBIA and return to work. Okay. Has anyone had tinnitus? If so, did it go away and how long did it last? So ringing in the ears. I see Santino shaking his head.
Yeah, I want to, if it was my most recent or the one before that, I started experiencing ringing in the ears, constantly. And I still have it, so it's been over minimum a year and a half, so I still experience it. Some days I barely hear it, and some days it's louder than normal, and I just have to sit in a room and just have white noise going on or distract myself with headphones on, and I can not like I won't be able to hear it if I'm doing something else, but I experience it almost every day.
Has it so it's currently every day as
Yeah,
well? Yeah.
yeah.
Okay. And is there anything that helps?
I haven't found anything yet, so still actively looking for it.
Yeah, I know they have apps. Like I don't know a lot about it, but I know there are some apps, and I don't know whether it just sort of provides some background kind of noise, but I was
Mhm.
just curious if you tried any of those.
I have not. No, I'll look into it for sure.
Okay.
Yeah.
Yeah,
So
I was just
yeah, yeah.
I
All
was
I've
just
been
curious.
doing is if it's super loud, I'll just put on a pair of headphones. I'll go play video games
Yeah,
for maybe an hour or so. So I'll just like my mind will kind of feel a little bit more relaxed. So I'm not hearing the constant ringing, or I'll listen
right.
to music or just try to keep myself distracted where I like my brain can't hear the ringing. I'll just hear something else.
Yeah. Yeah. Okay. Thank you. There was another suggestion. I apologize. I'm just going back and forth between the chat and the Q&A. Someone has recommended freecounselingcanada.ca, where they actually offer free 8 sessions. What else here? Right. Someone else has said, yeah, there are hearing aids to create background noise for tinnitus. Um, Someone has asked, I've had concussion symptoms for 15 months from a car accident, went to many physiotherapists and chiropractors with no improvement. Now have had a diagnosis of functional neurologic disorder. How does that differ from normal concussion, and is the treatment the same? And what is the prognosis versus concussion? That's a big question. The further that we get out from an accident, or from a concussion, I guess I should say, um, the more, it's always possible that symptoms that are arising are not necessarily concussion related. And this is why we no longer refer to post-concussion, it used to be called post-concussion syndrome. And unfortunately, so what would happen is, someone is years out from their concussion, but every symptom that they may be having is attributed to the concussion. And that's problematic because there may be something else that's going on outside the concussion. So with functional neurological disorder, it basically means that the symptoms that are being seen don't necessarily make sense from a neurological perspective. So it's quite possible that there are other underlying factors at work, and often, there can be a history of significant, in some people, significant trauma, but there may be, significant psychological factors at work as well that are also causing, distress. It doesn't mean the distress isn't real, but it's important that we know that whoever is treating, is sort of aware of, where it's coming from. So we're almost at time, so let me just see. Okay. Someone else has said, have people heard about the Concussion Legacy Foundation? They have peer counselors. So I don't know whether any of you did any of you have any kind of peer counseling at all? No. It doesn't sound like you probably need it because you had those resources through through school. But for those people that don't have that, that is something. So the peer counseling at Concussion Legacy Foundation, but also through the Ontario Brain Injury Association, basically you're assigned a counselor, and the counselor is someone who has also had a brain injury but has done training. They're further out. So it's that ability to talk to someone one-on-one who has been through this. Okay. Let me just see if there's anything else I can fit in quickly. And yeah, Rachel's saying, they've been 5 years out with a traumatic brain injury, but still unable to work. So again, it's different for everyone. It depends on what the persisting symptoms are, but it also depends on the nature of the work. Just as Antonetta, as you were saying, if you had to sit in front of a computer all day, which many people do these days, that it would, it could have, played out differently. So, okay. All right. There was another comment that the University of Toronto, and I wasn't aware of this, may have a clinic for neurologic music therapy in the music therapy department, which can be very helpful in recovering from head injury. So that is something I will have to look into because I haven't heard of that clinic. Okay. Well, I want to just take this time to thank all three of you. Really appreciate you taking the time to spend with us, to share your experience, to answer questions. It's so great to hear that, that it sounds like you've all had, pretty good experiences in terms of the support, and despite your different sort of histories. So thank you so much. I just want to let people know that, as always, we will have a survey that comes out, and very short. So if you have a minute or two, if you're able to provide your feedback and any suggestions for future topics. Also, if you have any questions that you feel didn't get answered, you can put that in there. I just always remind people that the survey is anonymous. So if you don't include your email address or something, where I'm not able to actually get back to you otherwise. And just a final reminder as well that we are going to have Dr. Nick Reed, who has a great talk about return to learn. So that will be on February the 11th. So we hope that that you can join us. And yeah, so thanks again, everyone. I wish all of you the best in the rest of your school years. And yeah, thanks again. Really appreciate you participating.